Member for Layla. Thank you, Deputy Speaker. I rise tonight to speak about two related topics: this government's cruel cuts to health funding and their lack of understanding of the support needed for those experiencing drug addiction issues. It is just over 2 years, one day before the Australian public entrusted this government to lead the nation. The day before, we heard these words: "We are not in the business of cutting health." Let me say it again: no cuts to health, no cuts to health. Once elected, however, this government has attacked Australia's health system at every level. After promising no new taxes, this government has attempted to slug all Australians with a $7 GP tax for every visit to a doctor, then tried a $5 tax. And as we know now, it is now slugging through a backdoor tax, a 4-year freeze on Medicare rebates, which is forcing doctors to increase fees and restrict bulk billing. The freeze, which commenced in July, will rip $1.3 billion out of regional practices over the next 4 years. In Lalor, with a bulk billing rate of 93%, this will have a huge and immediate impact on families. Our community, which already experiences an undersupply of health resources, which has very high rates of obesity, kidney disease, cardiac issues, just to name a few, cannot afford a reduction in health services. This government has tore up Labor's historic health and hospitals agreement with states, slashing $57 billion out of public hospitals. But worse, Deputy Speaker, is the cut, the $800 million cut out of the flexible funds which pay for mental health and drug and alcohol rehabilitation programs. And it's this last point that I want to discuss in a little more detail this evening. In my community, like communities across the country, young people, their families and their community are dealing with the impacts of methamphetamine use, abuse and addiction. At the launch of the National ICE Task Force on April 7 this year, this government promised the world on combating ICE. The Prime Minister said, "As a citizen and as a parent, I'm appalled at what is happening on our streets and in our homes." And we welcomed hearing him say that. Justice Minister Michael Keenan said, "This is an issue we're not going to police our way out of." Again, a welcome statement. Assistant Health Minister Senator Fiona Nash joined in, saying, "As I travel around the country, particularly rural and regional areas, it's becoming increasingly obvious the rapid escalation of the use of this drug." All three statements were welcome, but the reality is that we had a cut of $800 million from the frontline services that families are turning to for advice and support. And the actions that followed are worth looking at as well. The government has dedicated $20 million to an advertising campaign, which includes graphic TV ads that are an almost complete replica of another version that aired 7 years ago. And they might create awareness, but it is also, in some cases, creating anxiety. And that anxiety is sending families to seek support. But the services have been cut. The government has also dedicated scant funds to a dob-in-a-dealer hotline, which duplicates services already provided by the states and territories. Deputy Speaker, the suppliers of this drug in my community, I'm told by young people and their families, use a pyramid selling technique. I will sell to you and you have to find more customers. So who are we dobbing in on the hotline? Our children. I think this is counterproductive in terms of not being able to arrest our way out of this situation. In the last two budgets, the government has quietly ripped out a total of almost $800 million from the health flexible funds, which includes substance misuse funds supporting illicit drug treatment and rehabilitation, as well as prevention strategies. And we still don't know exactly how much will be ripped from the substance misuse funds and which treatment services will be affected the most. It could be any one of them across the nation. But that is not all, Deputy Speaker. Senator Nash waited until the last moment to extend funding to illicit drug treatment services that rely on the federal NGO treatment grants program. This caused considerable alarm, with organisations telling their staff that they couldn't guarantee their employment beyond the end of the looming end of financial year deadline. What is even worse is that only a one-year funding extension was provided. The sector is still operating in an atmosphere of uncertainty and anxiety. The entire handling of this affair has led to an urgent funding crisis that has made it extremely difficult for services to plan for the future, retain quality staff, and make strategic decisions about how best to do their job. Staff members have left to seek more secure employment. Others have delayed improvements in their services, such as new facilities. Across Australia, treatment and rehabilitation services are falling behind and unable to lend a hand to those seeking help to overcome addiction to ice and methamphetamine. Workers on the front line offering counselling, detox and residential rehabilitation are doing the best with what they have. They are working tirelessly, however, with one arm tied behind their back because of the government's mishandling of ice treatment and cuts to vital health funds. So while the advertising campaign worth $20 million goes on and creates more need as people become aware, I'm not suggesting it's a bad thing that people become aware, but not putting the services in place once people seek help is catastrophic. Deputy Speaker, I hear families locally telling me that they are seeking advice, and some of that advice is that they should let their children get to rock bottom, kick them out of home, so they become eligible to support and rehabilitation services. What happens to a desperate young person then? Do they move in with the dealer who's become their best friend? The young asking for help need to receive help. They need to know they can overcome a serious addiction. They need to be reassured there is a way forward, not just offered punitive law and order measures. We cannot arrest our way out of this issue. I believe we need to use less scare tactics and provide more support, real support, probably expensive support, to support the vulnerable that deserve our assistance. And Deputy Speaker, what of hope in this debate? The families I speak to who are living this nightmare are often frozen in fear and grief. They believe their child cannot recover. The direct treatment services I've spoken to say this is not true. They tell me there are thousands of recovery stories. I think it is behoven on this government to spend some of that advertising money on spreading that message, the message that there is hope. Yes, we have an issue, but there is hope. So I suggest this government should find the funds for the ads that not only create awareness, but that engender that hope, so families feel empowered to assist our young people. I further suggest this government ensure that when affected young people and their families seek support, they can find it. This will, of course, require funding. First, this government should put the funding back to frontline services, give surety to those working in the sector, make the funding on at least a 3-year cycle so that frontline services have that surety, find funds to spread a hopeful message about this, tell the stories of those who've recovered so that families can approach this with less fear and with more action, make families more likely to seek support, stop them being frozen in grief. Deputy Speaker, the cuts to health across the board are bad for my community, but the cuts in this area are critical for the development of our young people, critical that we don't lose an entire generation because we didn't offer them hope and we didn't offer them enough care. Thank you, Deputy.
I thank the